Good afternoon, evening, everyone that is joining us today. I'm excited to speak with you all for this autism awareness event today that is specifically focused in on understanding managing behavior problems in children with autism. So as you are joining the live today, feel free to post in the comments to let us know where you are watching from. Also, I invite you to share the video with others that may be interested in learning more about autism and about managing behaviors if you know someone who has a child with autism spectrum disorder. So today, the conversation is really going to focus primarily in on what are some tips and strategies that may be helpful for parents in terms of managing autism, managing behaviors that are associated with children with autism. So we have a lot of time for you to post some questions that are related to your specific concerns. And I have a special guest that's going to be joining me that I introduced in a second, that's also going to share a lot of information that is going to be helpful for you to understand how to help children cope with these particular challenges. But before we sort of jump into the conversation, I did want to provide a brief sort of introduction to who I am, and then I also introduce my guest in a second. So for those of you that may be new to Therapy for Black Kids, I am Dr. Earl Turner. I am a licensed psychologist, psychology professor, researcher, podcast host, a lot of different things that you can learn more about on my website. But I'm also the founder of Therapy for Black Kids, which is geared to help parents raise healthy kids in the 21st century. And that involves focusing on mental health aspects, as well as some emotional and social things as well for youth. And so I have some experience working with children on the autism spectrum disorder in my own work. And if you have not had a chance to check out the Therapy for Black Kids site on Instagram, you can also visit that page. I did a Instagram live a couple of weeks ago that talked more about early intervention with autism spectrum disorder. So that may be also helpful for you to get a little bit more information. So that's just a little bit about myself. I'm going to introduce my special guest who I am excited about having on today. Mr. Derrick Roberts II is joining me. Derrick is a graduate of the University of South Carolina. He obtained his undergraduate degree in experimental psychology and master's degree in special education with an emphasis in behavior analysis. Currently, he works as a board certified behavior analyst where he supervises and provides ABA therapy to children on the autism spectrum between the ages of 2 and 17. And he's also the co-founder of Village of Wellness. So thank you for joining me today, Derrick.
Thanks for having me, man. I'm excited to be here.
Perfect. So we sort of connected actually through social media. We're both members of Alpha Phi Alpha Fraternity Incorporated.
Yep.
And so it's great to have this opportunity for you to sort of share more about your sort of experience. And so I'm going to talk a little bit more about some of the sort of brief statistics about autism spectrum disorder. But before I did that, I just wanted you to sort of share a little bit more about the work that you're doing and really share with us about sort of anything that you want to add about your journey into working as a behavior analyst.
Yeah, for sure. So my journey began when I was an undergrad. I met a young man by the name of Chip who was legally blind and also had a specific learning disability. He wanted to go to college, get a degree, but of course he had some circumstances that got in the way. So I've always wanted to be a licensed psychologist. So I was wondering, so how can I do the work of a psychologist or some way give back to the community? And when I met Chip, he actually opened up so many doors and opportunities for me just by being a mentor to him. So after mentoring in undergrad, I went into special education. I taught for a couple of years. From there, moved into more of a clinical setting as my goal was always to be more clinical than than educational. So my journey's been great. I've enjoyed every minute of it. You can imagine I teach some of the brightest personalities and the funnest kids on the planet. So I really enjoy what I do, impacting one life at a time.
That's great. Perfect. Thank you. So we definitely need more people in the field that's doing this work. I know from my own experience working with children with autism spectrum disorder, when I was in Richmond, Virginia, living there, there weren't a lot of people that provided services to those families. And so a lot of the kids that I work with drove for, 30 minutes to an hour longer to be able to find a provider. So you definitely need more people that have your expertise. So just to sort of share a little bit, for those that are joining us today, again, feel free to comment in the chat box and let us know where you're watching from. This is Autism Awareness Month, and I wanted to sort of have this particular event to share a little bit more about, how can we help parents that may be struggling with this. And so if we look at the data and statistics for autism spectrum disorder, according to the CDC, about 1 in 68 children are diagnosed with autism spectrum disorder each year. We also know that it tends to be more diagnosed in boys than girls. And so autism is 5 times more likely to be diagnosed among males. We also know that white children tend to be identified and diagnosed much earlier than youth of color. So Black kids, Latino kids, Hispanic kids, Asian kids. And so that's also an area for me that's really important, because oftentimes we know that the later that you get in for services, then it makes it much more difficult for you to sort of learn how to navigate in and manage some of these challenges. So I'm really glad that we're able to sort of bring some awareness to this, specifically for communities of color that may be reluctant to have their child diagnosed with something like autism spectrum disorder. So I don't know about your experience, but I recall when I was doing my own training as a student, I had a family that I was working with that I diagnosed a child. I think the child was like 3 or 4 with autism spectrum disorder. And it sort of broke my heart, because the parent was like, are they going to grow out of this? And unfortunately, it's a lifelong sort of condition, but you can learn to cope with it. And so I think that's really important why we have these types of conversations.
Definitely, I wholeheartedly agree. You hit on one point that I think is really good to highlight, is that autism is more so identified in males than females, and that our white counterparts are oftentimes diagnosed much earlier and can receive the treatment at a much quicker rate than people of color. So those are great points to highlight, and very true. I even see that in treatment now.
Absolutely. So, I wanted to, again, have this conversation just to really focus in on like the behavior stuff. Obviously, like that's not the only aspect of difficulties or concerns that families may be dealing with. I think, from my own work, at least, I've had kids that had anxiety problems, or even problems with making friends, particularly for some of my adolescent clients. And so this is just sort of one small aspect of the things that we want to sort of touch on today. But for those that have questions later, we'll get to those, and feel free to, if you want to go ahead and enter those into the chat. I'll try to scroll through those when we get to that particular time period. But I do want to be able to provide some time for people that are watching to maybe interact with us as much as possible in this particular platform. So I want to jump into sort of my first question that I have for you, Derrick, and it's about sort of behavior problems that are associated with autism spectrum disorder, ASD. So in your own work, either through the classroom or through, providing ABA therapy, what are some of the most common behavior problems that you see?
Yeah, so I guess before I answer that question directly, I wanted to take a step back and say that all behavior is a form of communication. And irregardless to if you have a diagnosis of autism, this is Autism Acceptance Month, Autism Awareness Month, however you want to phrase it, all behavior is a form of communication. So whether your child has a diagnosis of autism or not, what is the behavior communicating? What is this person trying to communicate to me? Specifically, when it comes to children with diagnosis of autism, you want to look at understanding the function of the behavior that the child may be expressing in that moment. And the way that we look at it is we use the acronym SEAT. It may be sensory, it could be escape, attention maintained, or a tangible, access to a tangible. So knowing what the function of the behavior is can kind of help you deal with the behavior and know what you're working with and how to move and shake so as a parent. So the most types of common behaviors that I see in children in general, but more so children with autism spectrum disorder, is going to be tantrums. And so again, I'm going to keep going back to even typical developing children. All children have some type of tantrum behavior. And I don't like the word tantrum because tantrum can look different for all kids. Some kids may fall out on the ground, some may scream, some may cry. You may also see high rates of non-compliance or task refusal. You may see escape maintain behaviors, avoiding things. And for those of us who may not have as much experience in the world of autism, you can apply this to just about anything. So when you have a child who may have excessive tantrums or, property destruction or elopement behaviors where they, may take off and run and may not be aware of like safety issues and things that are going on around them, you may not know what to do or exactly how to respond to it. And hopefully today we can get into a little bit of that. But, the main behaviors that I see are going to be, tantrums, elopement, some property destruction, and even sometimes aggression. And you may also wonder, why are these behaviors occurring? And a lot of times it's because children with autism may or may not have the functional communication skills that you and I have to express our wants and needs in that moment. And then you have some kids with autism who have wonderful expressive communication. So it all depends on the child and, what their skill set may be and the behaviors that we'll see.
Absolutely, yeah. I appreciate you bringing up the point about the functions of behavior. And so as a psychologist, and obviously for you as an ABA therapist and those that do that work, that's a huge part of the work that we do with kids, is really understanding what are the functions of the behavior, what are those behaviors trying to communicate, and how are parents sort of responding to those behaviors in ways that sometimes maybe reinforce things that they don't want sort of reinforce. And so for those that have just joined us, we're talking about autism spectrum disorder and managing behavior problems. There was a IG Live that I did a couple of weeks ago that touched on some of these issues, as well as if you go to our YouTube channel at Therapy for Black Kids, you'll also see a video where I talked a little bit more about the things that Derrick just mentioned in terms of the functions of behavior. So you can be able to check out that video as well on the YouTube channel. But I appreciate you sharing these. I think, one of the things, particularly for younger children, is that those behaviors with like the temper tantrums or even the elopement or running away can happen in situations where kids may be really frustrated and they can't, communicate. And obviously, each child is different in terms of their level of verbal communication, but that's a huge aspect for some kids that may really influence how they may respond in different situations. So I'm glad that you sort of spoke up to that. So go ahead.
Yeah, for certain. And, autism looks different for just about every kid. There's never going to be a cookie cutter person who's on the spectrum. They're all different. They're all unique individuals. And even for my parents out there who are watching, it's also important to know that you're not alone when you're dealing with these behaviors or trying to manage them. There's other parents out there. There's other individuals who are, trying to work through these difficult moments. And that communication is a really, really, really big piece when it comes to problem behavior. Could you imagine if you were attempting to tell someone that your shoe was too tight and it didn't fit and it was squeezing the life out of your foot, and you weren't able to communicate that because you didn't have the language? You would engage in any type of behavior to get the attention or to get someone to help you remove the aversive thing that was going on. So communication is one of the number one reasons why we see some aggression, property destruction, and and maladaptive behavior overall.
Yeah. So there was a question that I noticed in the chat box, and thank you everyone that is watching and that has shared the video. Someone wanted to know about signs and symptoms related to autism, and there's a whole long list of those that people may look into. And again, if you go to the Instagram page, you'll see some more information about that. You can also check out the website Therapy for Black Kids. There is a blog post that I wrote a couple of weeks ago that talks a little bit more about early warning signs and early identification. So check out the website and you can find some of that information. But just a couple of things that I will highlight, and if you want to add to this, Derrick, feel free to do so.
Sure.
For me, one of the things that happens for really young children in terms of signs of autism is that they don't really respond to cues within the environment. So one example is if you call the child's name, they may not look in your direction or orient towards an individual. So that's one of the signs that may occur with autism spectrum disorder. Some kids get hyper-focused on parts of objects. So, for a lot of the kids that I used to work with, they would take cars that you may push across the floor and roll around, and they just may sort of sit and spin the wheels. So that's one example that sometimes occurs as well. And then when kids get excited, sometimes they flap their hands and those types of things. So those are just a couple of the warning signs. Again, go to the website here and you can check out the blog that's on autism as well. Did you want to add to a couple of those there?
Yeah, for sure. So again, autism looks different in just about every kid. So there's no cookie cutter way to diagnose, other than, speaking with licensed psychologists, sitting down and getting a full psychological evaluation. So that's first and foremost. But some signs that you can look for to recognize some perhaps symptoms of autism could be, not always understanding social cues, missing out on some of those early developmental milestones as a child, not having excellent, or even fair communication skills, stereotypical behavior. So, and then stereotypy is something that we all engage in. If you're sitting in a chair and you're rocking your leg, that's a form of stereotypy. However, in children with autism, they may tend to rock back and forth, engage in hand flapping. There's a whole myriad of different symptoms or signs that you may see in your son or daughter. But the best thing to do would be to reach out to a provider who has a background in autism spectrum, and maybe seek out the assistance of if not your primary care physician, a licensed psychologist who can kind of help, do an official evaluation, ADOS, SABASC, and different assessments like that to determine whether they fit the criteria that's in the DSM for autism.
Absolutely. Yeah. Just to sort of add to that, someone asked in the chat box about why Black children may get diagnosed later. Yeah. And so I think one of those is just sort of what you sort of touched on in terms of early identification, that we sort of see these things and we just sort of assume, well, they're going to be later in terms of walking or talking and those types of things, which is possible. There is a lot of, again, variability in terms of how kids develop. But if you do notice those things that, are extremely outside of the normal limits, that you do want to be able to get some help. Yeah. The piece of it is that we know that autism can be diagnosed as early as 2. That seems really young, but oftentimes if we don't catch it as early as we touched upon earlier, then it just makes it much more difficult for kids to learn the skills, how to navigate, and obviously for parents to learn how to sort of manage that. So I think if you notice these early signs, when they're 2 or 3, go to a pediatrician, go to a psychologist. I always encourage people that it's better to go and find out that nothing is wrong as opposed to sort of waiting till the child is 12, 13, and then you get the diagnosis of autism and you miss all of these opportunities for early intervention.
Exactly. And even why are our children, our people of color, diagnosed later? And there's, again, several reasons, access to healthcare, education, knowing the signs and symptoms. And then also sometimes we have parents, just like anyone else, he'll be fine. He'll grow out of it. It'll be okay. But at those times, they're missing what I would consider to be an achievement gap. And if you notice a speech delay, at 1 year old, at 2 years old, at 3 years old, and you don't address that with your physician or a licensed professional, that's time that kid could be getting services and getting treatment. And research and studies show the earlier you get intervention, the higher chance that they have a success in growing and development.
Absolutely. So I appreciate the questions in the chat. Continue to send those, and I'll get to those as we continue the conversation. But I want to go back to one of the other questions that I had for you, and you sort of touched on some of the common behavior problems that kids exhibit, and I'm wondering what thoughts or suggestions do you have for parents specifically that may have difficulties with getting kids to follow directions or comply. So let's say if it's time to like put your toys away, and obviously we can sort of have a lengthier discussion about what that may look like with kids with autism spectrum disorder. But just in general, like what suggestions would you offer for parents that may have kids with compliance difficulties?
Yeah, so for kids who have issues with compliance or task completion, you want to go back to those functions of behavior. You want to look at, is it sensory, is it escape, avoidance, or access to a tangible item? So my suggestion would be is all behavior is able to be modified and kind of changed. So if you want them to comply with something, there has to be some type of motivation. So if you can find a way to motivate or build a motivating operation, is what we call it in my field, to get them to comply with an instruction, that's going to be like a golden ticket for them to comply with what you're asking them to do. Another thing is setting expectations and routines. So whether your child is high functioning or low functioning, everybody can have some type of access to a routine and understand what's going on. The key as parents is to be consistent. And even if I have to provide a prompt, a full physical prompt to show them, all right, it's time to clean up, I'm going to do hand over hand. And next time I'm going to back up a little bit and do maybe a partial physical prompt and provide that, graduated guidance to help them engage in a task. That's going to be a very meaningful way to do it. Using timers. So in, making sure you have the child's attention. All right, let's say his name is Johnny. All right, Johnny, you have access to, your video games or your toy for 5 minutes. I'm going to give you a warning in 2 minutes. Set the timer, make sure they understand that they have understood your instruction and you know that in 5 minutes time is going to be up. Don't let them get too engaged. So there's a point where they reach like optimum engagement, and it's going to be even more difficult to interrupt that play if they're really engulfed in what they're doing. And when it comes to ABA, there's a science to it, and so that's a much deeper conversation. And if it's specifically transitioning from something that's really highly preferred parents, my suggestion would be to have something that's really highly preferred, transition to something that is less preferred, and then something that's non-preferred. So you're not going from hot to cold. You kind of go to hot, warm, and then cold. That way you may reduce some of those maladaptive behaviors you'll see when trying to transition from one thing to the next.
Yeah, that's a really good point. And obviously, this is only information that's helpful for you. It's not, we're not giving you therapy here, but it is some things that some therapists can be able to sort of work with parents on once they know more about your family, more about the child, more about, what are some of these functions that the behaviors may be occurring in your own settings. And obviously, kids are going to respond differently as well in different settings. And so I think for me, doing this work, I've always talked with parents about, we can get them to do this in, let's say, my therapy room. That doesn't mean that that's going to happen at school or at home or in public. Right. And so we also have to think about how can we get these behaviors to translate to other settings as well. So, parents sort of keep in mind, like, don't get frustrated if you know, well, it worked at home, but now when I go to grandparents' house or something like that, now this doesn't work.
That's really common, right? Even with typical kids at home, best behavior, do this, do that, it's not a problem. But the second you go to the grocery store or you step out and you go to grandma's, those skills that they have at home aren't generalizing over into another setting. So even with kids on the spectrum, it's all about consistency and knowing that it's a journey that takes time. And with time and consistent treatment, you will see some improvement, and those skills will generalize from one environment to the next. And there's tips and tricks on how you can get skills to generalize from one place to the other. But we can talk about that another time. But
yeah,
it's a whole science to it, and it works.
Absolutely. So I want to go back to, and those are really helpful strategies. I think like the timer definitely hand over hand for younger children is really helpful to like get them to sort of begin to comply. But you do want to, again, I want to put a disclaimer out there about using hand to hand, that it's a gentle like movement of the child. It's not like you're aggressively like grabbing their hand and moving them around. So you do want to sort of keep that in mind as well when you're using that particular type of strategy. But again, these are things that a licensed or trained therapist, ABA therapist, psychologist can be able to work with you on to really help you learn how to do this the right way, so that it is that it works and that it helps changing the behavior, as opposed to not working and then you get frustrated. Because I've definitely had situations where I've used things like a behavior chart with parents, and they're like, this doesn't work for me, I'm not going to use this. But when we really sit and talk about it, is the way that they try to implement it that ended up being the cause of why that didn't work. And so I think these strategies that you sort of talked about, it's also important for parents to sort of recognize that as well.
And even one more so for parents who do have children who are on the spectrum, knowing the function of that behavior and also the way to modify somebody else's behavior, a great way is to adapt yours, right? So if, you're frustrated, or if you're angry or something, you're kind of getting off kilter, and it's normal. It happens to all of us. We have to stay neutral. I call it a poker face. Keep your face very flat. If they're engaging in like elopement and, you're going to chase after them, or you're like shouting, you're upset, you're inadvertently reinforcing a behavior and increasing the likelihood that it's going to happen again, all in how you respond to it. So very neutral body posture, very neutral face, and very short phrases. So if they have issues with communication, you're not going to say, Johnny, you're running away from me, and I don't like that you're running so fast, and it makes you unsafe. Johnny, that all just went out the window. So very short, concise, and to the point.
Yeah. And then just to sort of add to that, I think sometimes when parents or adults respond in that way, where there is a lot of like frustration or whatever the emotion is on their face, is that for a lot of kids with autism, they don't understand those facial cues. And so they might misinterpret it. And so they may actually begin to like laugh at you, which it's a serious situation, obviously, but they may not see it that way. And so I think that's the other piece about why it's also important to sort of recognize how their lack of understanding of facial cues might also play a role in some of these situations as well.
Yeah, you're right. They don't always understand the social cues, and that's a big part of autism. And all they see is a really big reaction. And whether that is big and upset or big and happy, they're like, ooh, that's cool. I want to do what I did again to get that same reaction. So definitely got to be careful with that.
Yeah. So we're getting into this. It's really been a really great conversation. I'm watching the time. I know I wanted to keep this, within like a half hour or so. So we'll go through some more questions, and I have some questions that I am looking at in the chat as well. We'll get to in a second. But I want to go back to this idea about tantrums, and you sort of touched on earlier how kids with autism differ in terms of how they exhibit different behaviors. And obviously temper tantrums or tantrums, whatever terminology that you want to use, can look very different among kids as well. So what may be one tool or suggestion that you can offer for parents about how can you maybe even reduce the tantrum occurring so that you don't, obviously we can talk about the management pieces of it, but what are some ways that you can sort of think about how to reduce even tantrums from occurring, specifically when kids may be like transitioning between like an activity that they really enjoy to something that they don't enjoy, which you sort of touched on a little bit earlier.
Yeah. So I'll reiterate just a couple points. So if it's related to a transition, um, you know, denied access is always a big thing for kids. If there's a toy that they love and you take it away, they're going to be upset and they're going to respond with a behavioral reaction. So you want to set guidelines around the item that they're engaging with. We have 5 minutes. We're going to transition after 5 minutes and, set a timer. And then instead of moving from, let's say that his favorite thing in the world is Superman, he likes Batman and he does not like Spider-Man. You're going to give him access to Superman for 5 minutes and then introduce Batman. Hey, let's play with Batman for a little bit. And then we can go to Spider-Man. Now, that's a very, small example, but I believe you kind of understand what I'm trying to say. So don't go from really great heavy reinforcement to something that's not reinforcing at all. So in addition, with the tantrums and how to reduce it, you want to look and understand the function of the behavior. Why is it occurring? Is it internal? Is it something sensory? Is it the lighting is affecting them? Or is it, equilibrium is off? Or, do they need deep pressure in that moment? Is it sensory? Is it escape? Do you notice that every time you put a math problem in front of your son or daughter, or every time that you take them into a specific place, that they engage in maladaptive behavior? So that's telling me that they're trying to escape this environment. Is it attention? So will the kid scream and have you look, to see if you're looking at them? Or is it access to something that they want? So if you know what the function is, it'll better help you know how to respond. And if it's access to a tangible item, right? And let's say that you want them to engage in a non-preferred task. You can say, first, clean up, then playground, right? So you're building behavioral momentum. First, I want you to engage in this, but when you do this, you're going to get access to something very preferred. So simple language, first and then statements, knowing why the behavior is occurring and what they're trying to communicate is going to be paramount in reducing those maladaptive behaviors. And it doesn't happen overnight. And you try one day and it may not work. And the first time you try it, there's a great chance that it won't. But that's the thing about the field. We take data over a series of weeks and weeks, and we analyze the smallest parts of the behavior to know, okay, is this variable that I'm changing increasing or decreasing the behavior? Is how I'm responding. I deal with some of the most interesting behaviors, and my response oftentimes will indicate, how much that behavior is going to continue to happen, or how to reduce that frequency of it occurring.
Absolutely. Yeah. Thank you for sharing that. And so I want to mention for those that are watching again, I mentioned this earlier, but I want to mention again because you talked about the functions of behavior piece. So if you go to the YouTube channel for Therapy for Black Kids, you'll be able to see a video that I made a couple of weeks ago that talks more about functions of behavior. And that is really helpful. Again, providing you some general information as was offered here today, but also these are things that, again, a trained ABA therapist or a licensed psychologist that works with children can be able to sort of help you to better understand why your kid may be exhibiting some of these behaviors and how you can be able to better manage some of those things as well. I want to go back to a question that I saw come through in the chat box, and I'm hoping that maybe you can answer this a little bit.
Okay.
And so one of the I hope she's Ranta, I think is her name, is still watching. She mentioned that she finds that many SPED teachers and other education providers are not educated in autism. And so how do you help teachers when they don't have that sort of knowledge? And she was asking specifically for her son, like what should she do in that situation?
So that's a tough one. I used to be a special education teacher, and training is extremely important. So how to approach the situation. So the first thing I would do is educate yourself. Learn as much as you can about autism, and you kind of want to look at treatment that can be applied in an educational setting. If there's a diagnosis or a disability that's present, your son or daughter or the child that you are speaking about should have what's called an IEP or individualized education plan or a 504 plan. Within that educational plan, the child's needs and limitations and areas of deficits should be addressed in that plan. And you want to go to the IEP meeting, and I want to empower all of my parents that are listening. You are the client. You are the person who can make the most meaningful change in your son or daughter's life, especially in the school setting. IEPs and 504s are legally binding documents. Mention it at the IEP meeting. Make sure it's reflected in the notes. And I call them sometimes. I have to call sometimes it's my moms. I call them my warrior moms to stand up and really fight and advocate for your children. So if they're in a classroom and their needs are not being met and you feel like it's a training issue, seek out training opportunities that will benefit the district. Meet with your administrators, talk to the school principals. Don't stop. And, I was a teacher, and I would prefer to have the parent who is a relentless parent to do what's in the best interest of their child than the parent that's not involved. So get in there, stay in there until they know you by first name, and whatever opportunities you feel will be beneficial for your child or any child with a disability. Find a way to introduce it to that school setting. Find an ally. Find someone who's on your child's team or on your side who believes in them and who you can foster a relationship with. That way, when you bring something to the table, at least you have one person in your corner to support you. But training is going to be very important, and it needs to come from the school level and a district level from somebody who's a professional in the field. I hope that answers the question.
Yeah, it's definitely a tough question, and I was smiling because I've been in situations where I've been in those team meetings, and obviously, like for parents, I think one, there's so much information that's thrown at you sometimes that you don't know what to do with it. You're still processing some of that, and then other times you're not sure what your rights are. And so I've definitely had to do what you just said here, is really make sure that parents know what their rights are, that they advocate and speak up for those things in those meetings, so that so that the school knows that the parent has this knowledge and that they can't just sort of get off without providing the services that they need to provide. Because if schools can not have to put the budget into it, unfortunately, they're not going to do it.
Right.
So I think it's really important for parents to sort of recognize that.
Yeah, and even when you're in those IEP meetings. So first, when it comes to an IEP meeting, there's a thing, rights and procedures for parents, and always accept it, always read it, and know what's in it. You can call an IEP meeting, 504 plan meeting at any time. It's up to the parent. You can say, I need to have an IEP meeting, and this is what I want to discuss. You can also take an advocate to the meeting with you. And that's the great thing about so many consultants out here, is they'll attend a meeting for you. And if you realize that in the IEP plan that the goals are not meaningful and are addressing the needs that your child has, we need to talk about that in this meeting, right? And we're not coming on a high horse. We're seeking to understand and to obtain information. And I want to be a part of my child's treatment so that they are successful.
Absolutely. Yeah, thank you for that. And then the other question I wanted to go back to was about that denial piece. And we've sort of touched on this a couple of points today about how the diagnosis rates for Black kids or other kids of color is much later. And so I'm wondering what your thoughts are. And that was a question here in the chat about how much does denial play into that later diagnosis? And I'm wondering what your thoughts are about that.
Yeah, so I don't have any children, and so I can't imagine like the impact or how it would feel to have a child who has some type of developmental delay, a diagnosis of any type, no matter big or small, what it is. So having to accept that is beyond difficult. So I could imagine. But do I feel like denial plays a role in delayed treatment? Yes. I can't stress it enough. If you have a concern, or if you think that something may not be exactly right, the sooner you inquire, the sooner you just ask or think about it, or even, take a step back, ask a friend, somebody you trust. Okay. So I noticed that my son or daughter is doing this. find a teacher. And most times teachers have a lot of insight because they work with typical developing children so often. And, they'll be able to give some guidance and say, well, typically by this age, this is going on. So I would recommend speaking with this person. Denial is a big part of delayed treatment. And I know it's tough and I know it's hard, but parents, the sooner we get our kids into treatment, the sooner they can start making some progress towards having a meaningful life. And I just want to address this. So even if your child doesn't have a diagnosis, they do have a diagnosis of autism. I've met some of the most bright individuals, extremely intelligent, live the most independent lives that you could ever imagine. And they have a diagnosis of autism. So just because your son or daughter may have a diagnosis, it doesn't mean that they won't accomplish certain things and be able to matriculate through life. It's just what I would call a diverse ability. It's something that makes them unique and they can still grow.
Absolutely. Yeah, I'm glad that you brought that up, because I think for me, when I brought up that example earlier about the parent who had this sort of reaction about, is my child going to grow out of this? As one of the, I think, first families that I diagnosed a child with autism, and it broke my heart. But at the same time, I think it's also important to, again, reiterate for parents that early identification, so being 2-3 years old, can be really helpful and a strength, because now it provides so many more opportunities for you to get early intervention, to make sure that as that child grows and adjusts, that you can be able to sort of adjust with them and get them the tools that they need in terms of independence and friendships and communication. And so all of those things can be really helpful, and they can grow up to be adults that are very independent and navigating life in a very successful way. So although it can be something hard to hear, that it's not the end of the world or end of your child's life if they have that diagnosis or label.
Yeah, so even now, currently, the majority of the kiddos that I work with are youngsters. They're younger kids, and at a younger age, there's so much that you can mold, you can shape, and you can kind of adapt. And they're at that point where they're so impressionable. And if you catch these things early, you're not having to go back and reteach a learned history of behaviors. The sooner the better. We can get in there, if they're just starting to engage in tantrums, right? And they're 3 years old and they're not really communicating, and then you wait until they're 13. Now they've gotten bigger, they're stronger, and now you may risk that, hey, now they're engaging in some aggression, some property destruction. Whereas if we gotten treatment sooner or earlier, we could have gotten some type of functional communication to say that I'm angry right now. And they learn a different way to express that emotion versus engaging in property destruction. And, it varies. Not all kids engage in property destruction and anything of the sort, but when behaviors aren't addressed, sometimes they can escalate and grow in magnitude, and if they are left untreated. So get treatment as soon as you can.
Absolutely. So that is really a nice segue as we get ready to sort of wrap up, because my next question that I was going to ask is, what suggestions do you have for parents about, finding a therapist, and specifically ways that they can maybe find an ABA therapist, which we know is really helpful for kids that have autism spectrum disorder?
Yeah, so if you're looking for ways to connect or find an ABA therapist, there's a website called Psychology Today. You can find board certified behavior analysts on there. You can also go to bacb.com, and that's the ABA website where you will find BCBAs who are credentialed and who are licensed therapists to work with your son or daughter. Also, you can get referrals from your pediatrician. You can call your insurance providers and let them know that I'm looking for an ABA therapist in my area. And, sometimes it is hard and difficult to find an ABA therapist that is credentialed and licensed. And that's going to be one thing I really want to stress. There are a lot of people out here who may say I'm a behavior consultant or I do X, Y, and Z. And, those people are great. And, but I want someone who's board certified, who has the credentials to back up what they're telling me, and can really provide treatment that is evidence-based and can make a significant impact in not only your child's life, but in your family's life as well.
Perfect. Thank you so much for sharing that information. Someone posted Therapy for Black Kids in the chat box. I also posted the Psychology Today as well. Thank you for posting those links for me so that I didn't have to do the work. You can also go to therapyforblackkids.org, and there's also a tab on the website where you can be able to find providers as well. I think, again, the most important piece that I always encourage parents to think about is that sometimes people list all of the things that sort of Derrick mentioned in terms of their background and experience, but I think it's also important to have a phone like conversation or consultation with that person to specifically ask about their experience. And so that can be more helpful for you, or to see if they offer, sometimes they offer a free, intervention, a free consultation meeting, where you can be able to go into their offices. And obviously, right now, for many places, there still is opportunities for some telehealth or virtual therapy. And so I would say take use of those opportunities to really sort of check in to see, is that the person that is the best match for you to be able to help you out.
Right. There's a lot of information out there, and the worst thing you can do is get misinformation and be misinformed. So, knowledge is power. We talked briefly at the beginning about, the organization that I co-founded, Village of Wellness, and it's simply just a space for parents to come, ask questions, to get information, for psychoeducation, to learn about what is going on. I don't understand. I need help. Someone, kind of give me information that will help lead me to the right place and get the right treatment for my son or daughter. So I would definitely, knowledge is power. The more information, just be a sponge and get it all you can to help your son or daughter.
Perfect. Thank you so much for sharing that. And so for those of you that have watched today, thank you so much for tuning in. Please feel free to share the video with others that you may think the information is helpful for. And also make sure that, again, you utilize those links that are in the chat box if you're interested in finding a provider that can help you out. And one last mention of the Therapy for Black Kids website. If you go to the blog again, there is a recent blog on autism. So for those of you that want to learn more about these early warning signs and want to share that information with parents that that you may be curious about, does this child fit this particular diagnosis? That can be a really a touchy subject to bring up to someone. Sometimes just sharing information may be helpful as a way to sort of begin that conversation. So I wanted to sort of put that out there. But before we wrap up, I wanted to, again, just sort of to thank Derrick for joining me today to discuss this particular topic. And I invite you to connect with him as well if you wanted to share any ways to be able to do so.
Yeah, I will put my information. I'll give it all to you, and you can disseminate it however. But right now it's just villageofwellness@gmail.com. It's the best way to get to me. But for my parents and those who are listening, you're not alone. I work with parents and families every day, some who are just receiving diagnosis, some who've had diagnosis for a long time. There are support groups out there. There are people out there who genuinely care. Your child can grow. They can be successful. And, don't be ashamed. It's Autism Awareness and Acceptance Month. So everybody, let's try to light up blue for autism awareness. And let's all do the work together.
Perfect. Thank you for sharing that. I will be sure to post that information on the Facebook page when this is over. And if anyone has not subscribed to our newsletter, feel free to check out the website at Therapy for Black Kids and subscribe to that newsletter. So take care, everyone.